Hello, my name is Dr. Ernest Kaninjing. I am an assistant professor of public health at Georgia College in Milledgeville, Georgia. I am also one of the principal investigators for the iCCaRE consortium to eliminate prostate cancer among Black men. As you probably know, prostate cancer is a disease that affects all men. According to the American Cancer Society, 1 in 8 American men will get that diagnosis at some point in their life. But the issue is not all men or not all ethnicity or ethnic groups are affected in the same way. The American Cancer Society estimates that among Black men, they are twice as likely to die from prostate cancer. So the iCCaRE consortium is a group of investigators around the world. 4 of them, at least 4 major projects in the United States, 1 from abroad. We're taking a comprehensive look at different factors that impact these differences in prostate cancer outcome. Now we call that disparities. Disparities simply means there are differences in how prostate cancer affect men. We are specifically focused on Black men. Now, among Black men, we also want to look at within group differences. So I am the project principal investigator for one of the projects that is specifically looking at the subpopulation of Black men. Particularly, we're looking at African immigrants. We're looking at African immigrants because it's interesting to understand the dynamics when people leave Africa or they leave the Bahamas or wherever they live and they come to the United States and they start living in a new environment. What is the dynamic at play that also exacerbate or worsen outcomes in prostate cancer? So we are actually focused on one of the projects for the iCCaRE on looking on social, economic factors that impact prostate cancer. By understanding the factors that impact prostate cancer gives us the opportunity to design specific interventions that are tailored among this population. Again, keep in mind, we mentioned a short while ago that prostate cancer affects men of different race and ethnicity differently, which means to intervene to reduce prostate cancer rates, we have to have specific tailored intervention. The United States President Joe Biden recently launched the Moonshot Project. The goal is to reduce cancer rates by 2050 in half, to reduce the incidence, that's new cases, or the prevalence of cancer rates in half by 2050. So the iCCaRE consortium is one approach, one project that has been funded by the Department of Defense towards getting us towards that goal that has been stated by the US President. So what we're trying to do, we're taking a look at, again, as I mentioned, social determinants of health. Social determinants of health simply means the factors that impact where people are born, where they live, where they grow, where they worship, where they play. It has been said that your zip code really determines your life expectancy more than any other factor. So we want to take a deep dive. What are some of the factors among where people live, where they play, where they grow, that has a negative impact on prostate cancer outcome? So that is one of the studies that we're doing in iCCaRE. There are some 4 other projects that are also looking at these disparities from different angles, and I'm sure given the collaboration we're getting with other colleagues, we definitely will be coming with different approaches to help us get towards the pronounced goal of the Moonshot Project to try to reduce the differences in cancer outcome. Thank you so much for your time. Have a great day. Bye-bye.